Stimulus package, more than $480 billion for small business and for testing in this country, passing the Senate. What the president said about this just moments ago. And the warning late today from the head of the CDC, now reportedly saying there's a possibility the assault of the virus next winter will actually be even more difficult than the one we just went through. Why he believes that. Also, that face-to-face meeting at the White House. President Trump, New York Governor Andrew Cuomo. Governor Cuomo saying he wanted that meeting to talk about testing. The governor now calling it a very good conversation and that it was, quote, productive. What will this mean amid growing calls for federal help for widespread testing? The death toll in the U.S. now approaching 44,000 lives in New York, past the peak, but still 481 lives lost in just 24 hours. Inside a New York City hospital, a mother recovering from the virus, meeting her newborn baby for the first time 25 days after her birth. Tonight in Massachusetts, still seeing a surge, and this evening the Illinois governor saying their peak is still weeks away, mid-May. Meanwhile, several states moving to reopen, and quickly, some by the end of this week, even though they haven't met the guidelines from the White House. Georgia, for one, planning to reopen gyms, hair salons this Friday, theaters and restaurants after that. Mayors sounding the alarm tonight. And that breaking headline from Capitol Hill, that new more than $480 billion relief bill, now on the way to the House. We ask where the money will go and who will be helped. We're also on the front lines tonight with emergency crews in Boston, the EMTs, with hospitals still facing a surge. And as that state fights the virus, they're also preparing for the next step, to get workers back to work using contact tracing. That state already hiring 1,000 so-called disease detectives to trace any new spread of the virus. So how will this work? And is it a model for what we'll see across this country? We are with American workers tonight, the small business owners struggling to survive, in need of a lifeline. Our Steve Osunsami with those businesses, as Jon Karl asks at the White House, will they ensure the right businesses get that money?
This is ABC World News Tonight with David Muir.
Good evening, and it's great to have you with us here on a Tuesday night. And as this country faces its next major challenge, trying to save jobs, save businesses, save livelihoods without risking lives, there was major news on this front today. A $484 billion stimulus bill has just passed the Senate. The president speaking about it moments ago. It will help small businesses. It will help their workers who they're trying to save. They need it. It will also fund testing. The Treasury Secretary saying just moments ago it will give an unprecedented amount for testing. It comes as the death toll across America now approaches 44,000, still more than 2,000 lives lost in a single day. Hard-hit New York on the way down from the plateau, but that number, 481 lives lost in just the last 24 hours. In one New York City hospital, this mother, a coronavirus survivor, meeting her newborn daughter for the first time 25 days after she was born. But tonight, from Illinois to Massachusetts, governors warning they have yet to reach their peak. And we are on the front lines in Boston tonight with an EMT crew answering calls. That state battling to handle the surge, the governor closing schools for the rest of the year and hiring 1,000 contact tracers who will track any second wave of this when workers begin going back to work. Our report tonight on how that will work and will it be used across the country. The Illinois governor saying the peak there will likely come in mid-May. Meantime, South Carolina lifting restrictions tonight. The crowds at the beaches today in Georgia, Tennessee, Texas, Colorado, all moving to reopen. Hair salons and gyms reopening in Georgia Friday amid outrage tonight from mayors who say this is just too soon. So we will get to it all tonight, including those words from the head of the CDC late today, reportedly saying there's a possibility a second wave of this next winter could be even worse. Tonight, why he suspects that to be the case. But we begin with Whit Johnson right here in New York.
Tonight, as America considers its future beyond the pandemic, Chaplain Rocky Walker of Mount Sinai Hospital in New York warns of a second wave of suffering.
And that is a wave of depression, exhaustion, and weariness on the part of the healthcare workers themselves.
The chaplain witnesses doctors and nurses giving everything to fight.
I see God in their reaction, their response, their courage, their faith.
And today, a shining example of what healthcare workers are doing in this crisis. A precious delivery inside Maimonides Hospital in Brooklyn. We first met Iris Nolasco 2 weeks ago. diagnosed with COVID-19, then separated from her newborn baby girl after an emergency C-section.
I just hope that I'll be, able to hold her and then just protect her.
Today, mother and daughter reunited. A new chapter for little Isabella Michelle.
Can I touch?
Yes, it's yours. Go for it.
Relief after 25 days apart.
You can explain how much it hurts knowing that you have a baby and you cannot hug her.
Today, New York's Bryant Park with this message of thanks on its empty lawn for all essential workers. New York's Governor Andrew Cuomo acknowledging the number in his state are heading in the right direction.
Our calculus of good, our definition of good has changed here. Good is now not terrible.
Today, Cuomo heading to Washington to lobby President Trump on the one thing so many governors and health officials call key to reopening: stepped-up testing. A new Harvard study shows the U.S. needs to conduct between 5 and 20 million tests per day. So far, there have only been 4 million tests total. Cuomo says New York labs are ready and waiting, but he needs the president's help to get testing supplies.
You shouldn't expect all these governors to go run around and do an international supply chain.
Even as New York comes down the mountain, other states still bracing for the worst. In Illinois, the governor saying the state won't hit its peak until mid-May. Cases still surging in Massachusetts, the death toll climbing to more than 1,500.
The data shows we're still very much in the grips of a pandemic.
But 3 southern states are making aggressive moves to reopen, though none of them are reporting a steady 2-week decline in cases as the White House guidelines recommend. Georgia Governor Brian Kemp facing a local backlash for his ambitious plan to open gyms, hair salons, and bowling alleys on Friday. Some movie theaters and restaurants next week.
When we have more people moving around, we're probably going to see our cases continue to go up. But we're a lot better prepared for that now than we were over a month ago.
Kemp now taking heat from mayors from Albany.
I pray that the number of Georgians who are infected and die will not increase significantly in the coming weeks as a result of the lifting of these restrictions.
To Atlanta.
I certainly cannot in good conscience say that I agree with his order, and I will continue to use my voice as mayor of Atlanta to ask people to continue to stay home, follow the science, and exercise common sense.
But some business owners like Shannon Stafford, who owns a beauty salon in Savannah, are desperate to reopen.
It's just a scary situation all the way across the board. But we're in a situation where we have to work.
In neighboring South Carolina, Senator Lindsey Graham tweeting, "I worry that our friends and neighbors in Georgia are going too fast, too soon." Adding, what happens in Georgia will impact us in South Carolina. But South Carolina is easing restrictions too. Beachgoers allowed back to the shores, people grouping together with chairs and coolers.
It's showtime!
Some businesses opening their doors to eager customers with social distancing limits. In Washington tonight, word Congress has struck a deal on a $484 billion plan to help the economic recovery, including new loans for small businesses, plus more money for hospitals and testing.
There have been some big businesses that have taken these loans. I was pleased to see that Shake Shack returned the money.
Obviously, Shake Shack was not alone in being a big company that got money in this. Are you going to be asking? I'm going to request. You're going to ask them to return that money? Yep.
John Carl on following the money trail with the president and the Treasury Secretary just moments ago, and we want to bring in Whit Johnson with us tonight. And Whit, that other news late before we came on the air tonight, that warning from the head of the CDC reportedly telling the Washington Post that the second wave of this virus next winter could be even worse.
Yeah, David, and the CDC director saying in that interview when he warns people about that second wave, they just kind of put their heads back. They don't understand what he means. Dr. Birx was just asked about this during the White House Coronavirus Task Force press briefing a moment ago, and she said if there is a rebound later in the year, we are better prepared, able to watch for warning signals early on. David.
Let's hope so. Whit Johnson, thank you. And Dr. Jen Ashton is standing by with more on this in just a moment. And even though the plateau has been reached here in New York, still at a devastating level, we note that in Illinois and Massachusetts and elsewhere, they're still fighting the surge of this virus. And tonight we're with the EMTs in Boston as that state also prepares for the next eventual step, They're using contact tracing. They've hired 1,000 disease detectives, as they're called, to track any new waves of this virus. We've heard a lot about this, so we wondered tonight, how will it actually work? Here's Will Reeve from Boston tonight.
Tonight, Boston in the grips of the pandemic. We're with the first responders working round the clock, fanning out through the city, answering call after call, many of the patients suspected to be sick with COVID-19. EMTs taking every precaution, scrubbing up in layers of PPE. The patient has been loaded into the ambulance. The EMTs took off their scrubs, disposed of the PPE. Now they're headed to the hospital. The grueling routine taking a toll on these first responders.
There's no sugarcoating this stuff. We're drained. We are exhausted.
The death toll in Massachusetts nearing 2,000, with hospitals bracing for any surge, the state battling the virus on another front.
Got to do this right, and we've got to respect the virus. Big time.
Fighting to stop the spread with a critical tool, 1,000 contact tracers who call anyone who's tested positive so they can alert others who came within 6 feet of that person for more than 15 minutes. These so-called disease detectives like Mia Williams in Kentucky are working the phones.
It's like an emotional roller coaster in a way, because what you're trying to do is connect all these cases, and from connecting all of those cases, you're trying to prevent or control spread.
I work for Salt Lake County Health Department.
In Salt Lake County, Utah, tracers have tracked 85% of the known cases there.
Will Reeve with us from Boston tonight. And Will, this contact tracing sounds probably for people at home like an overwhelming undertaking as this country prepares to reopen. So these contact tracers in Massachusetts, they want to find anyone who has had close contact with people who have tested positive?
Yes, David, and that close contact is defined as coming within 6 feet of someone for 15 minutes or more. So anyone who comes into that close contact with someone who has tested positive will be asked to self-isolate. Now, those tracers here, they have a lot ahead of them. This process starts out with phone calls to individuals, and so far in Massachusetts, there have been over 41,000 confirmed cases. David?
Wow. So anyone within 6 feet for 15 minutes or more. Will Reeve, our thanks to you for that report tonight. And now the small businesses in this country waiting for that news today. Owners trying to save their businesses and really save their workers. Here's ABC's Steve Osunsami.
Business owner Mary Moore in Atlanta.
Welcome to the Cook's Warehouse.
Says she's trying her hardest to keep 12 of her best people on the payroll. She's already had to lay off 43.
They rely on this business for their livelihoods, and I rely on them.
She owns the Cook's Warehouse stores and is trying to make the best of sales online. She's applied for government loans but hasn't seen the final paperwork and says the program is unfair to small businesses like hers.
It's really difficult as a small business person to hear how big corporations are getting grants and they're being given money, but I've got this great opportunity to create more debt for my business that, I have to figure out how to pay for in the future.
An Associated Press investigation tonight speaks to this, finding that of the $349 billion in relief meant for small businesses, at least 75 companies that were helped are so big that they're publicly traded, and some had market values greater than $100 million. Big chains like Ruth's Chris got money before the pot ran out last week. Shake Shack, another big guy, gave $10 million back to the government after the outrage. As for that $384 billion in new help for small businesses, at Ben's Chili Bowl, a local institution in the nation's capital, they're still worried.
When we reopen, are we able to seat 50 or 60 or 70 people when you have to have some sort of social distancing, et cetera? So it impacts the entire business all the way around.
Nearly half the nation's workforce gets a paycheck from small businesses like these. This time, the money meant for small businesses should be spent a little differently. About $60 billion has been set aside for these small businesses to go directly to them, but there is general agreement that this money still may not be enough. David?
Well, with John at the White House and you on the ground, we'll track that money in the weeks to come. Steve, thank you. The president also making news just moments ago after his tweet overnight on immigration saying he would temporarily halt immigration to the U.S. He offered more on this just a short time ago.
By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad.
Reading from prepared comments there, let's bring in our senior White House correspondent, Cecilia Vega. And Cecilia, the president saying this pause in immigration will be in effect for at least 60 days. He said he'll look at where the economy stands afterward. But Cecilia, a lot of people have been asking all day, weren't there already strict measures on immigration in place in this moment? So does this announcement change anything significantly?
Well, David, you're right. There were strict orders. There are strict orders already in place, but even a temporary pause would be unprecedented in this country. Look, here's what we know. There will be some exemptions for healthcare workers, agriculture workers, people like that. But you heard the president say this is about protecting American jobs. He also says this is about protecting Americans from the coronavirus. But David, we've got to tell you, America has more confirmed coronavirus cases than anywhere else in the world. We should also note that the number of immigrants who are on the front line in this fight right now, 1 in 4 doctors, 1 in 3 nurses are immigrants. David, opponents say that this is a clear example of the president using this virus to further his hardline immigration policies. This one sure to end up in the courts, David.
All right, Cecilia Vega, great to have you with us, Cecilia. Overseas tonight, British Prime Minister Boris Johnson, who did not take measures quickly in the UK, instead proudly saying he was still shaking hands, of course coming down with the virus, now recovering, and tonight with a different message. ABC's James Longman now.
President Trump today speaking to the British Prime Minister for the first time since his hospitalisation for COVID-19. Boris Johnson is still recovering and Britain is still suffering. His critics say he acted too late. This is him last month.
I want to stress that for the vast majority of the people of this country, we should be going about our business as usual. And
appearing to make light of the threat.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
But now, having had the disease, Johnson is reportedly wary of lifting the lockdown and further crippling the economy. Denmark, meanwhile, is re-emerging because it acted so early. Schools and small businesses back in action. That's because they shut down the country on the day of the first death.
Denmark might have locked down, but just over the water, its neighbour Sweden has gone in a very different direction.
No lockdown at all and a higher number of cases, but crucially, an economy still moving. Too early, perhaps, to say if the gamble pays off, but across the continent, different approaches are being tested to their limits. And around the world, female leaders are being praised for their decisive actions. From here in Denmark to Germany and New Zealand, countries led by women are showing some of the best results in battling the pandemic.
There is some hopeful news from the UK tonight, David. 500 people have come forward to take part in vaccine trials, and they'll start this week. David?
That is promising news. James, thank you. And when we come back, the head of the CDC on the possibility the second wave of this virus in the U.S. could be worse. So why does he believe this? Dr. Jen Ashton standing by.